Welcome to this conversation.
Thank you for having me.
As you know, here is working on looking at the future beyond the pandemic, and particularly holding this conference. What's next? In the past couple of days, you have been very active on social media, on Twitter, raising questions and perhaps an inconvenient question around the use of language, what is appropriate and what's not. And I think my sense is that basically this pandemic is asking us to rethink the way we work, to reflect on also our use of language. What do you think? What are the changes that you see are needed that this pandemic is requiring us to make?
Thank you, Ed. So that conversation on social media is surprising to me in the sense that it actually got people interested. And it was me trying to talk to myself through a tweet because I keep getting second thoughts about what I say within the context of our work. And some of the things we say are obviously should be examined, unacceptable anymore. We call people beneficiaries. We define people we serve by their benefit from us. And that is a language that is used to entrench the powers, the power where they are and prevent them from distributing. In medicine, we stopped doing that. You know, it used to be well, not stopped, but on the way of stopping to use that. In medicine, it's not acceptable anymore for a doctor to refer to a patient as, the liver cancer. Can you please see the liver cancer in bed 12? You don't diminish people into their diseased organ, and you don't diminish people to their need for humanitarian aid. On the other hand, we use the grandiose, dedication of humanitarians on ourselves. We're not staff of a humanitarian organization. We are humanitarians. A bit of sacralized description, as if we are given a sacred mission to do something. And then you go from there. And a lot of things are obvious. We don't use third world anymore. We don't use tropical medicine anymore. We use global health, but that in itself has its problems. The question, and I now have a list of about 300 words/expressions that people suggested that shouldn't be used or should be changed. And I don't think that's feasible. I think it's important to know them and to know what people's objections to them. But the exercise is more of realizing how we entrench or distribute power by everything we do, by our place, positionality, by the language we use, by the imagery we use. COVID is a very good indication. You Google Ebola, and there are plenty of images of Africans dead or dying in undignified positions, in their deathbeds, faces exposed, identities clear. There aren't many of those about, Italian or French or German or British patients. There are things that should be re-examined. Now, you asked me, what do you see the changes to the pandemic requires? I think the pandemic happened in a time where another movement is happening and examining whether there is structural racism and humanitarianism, whether we are being a proxy or an extension of colonialist attitudes, and whether we are as innocent and benevolent as we think. Pandemic specifically, I think what needs to change is our perception of ourselves and what emergencies are. The world, not only humanitarian, has and is failing miserably in achieving any kind of move towards equality in response to the pandemic. And that, a lot of people are saying this is an unprecedented emergency. And it is true, it is unprecedented, at least in the very modern era. But let's have a couple of scenarios ahead of us. This is a pandemic of COVID virus. And this is not a huge pandemic. I say that because if we had an influenza pandemic, a la 1918, which has been used many times, it won't spare children. And it won't be containable, at least as with a single vaccine or so on. Imagine this pandemic happening at a wider scale and not sparing small children. That would be a huge issue, bigger than this one. Now, that is still a single disease, single solution. Vaccine hopefully will work to a certain extent and will give us a way to defeat the pandemic, hopefully in an egalitarian way. But imagine they fully predicted, fully mapped consequences of the climate crisis. When we start having sea level rise, crop failure, the consequent conflicts and so on, not only affecting poor countries, but rich countries. Now the West has rich countries, high income countries, call it what you want, has started showing how little care they give until they get their fill of the vaccine. And this is the first time they are affected equally, or not even equally, but affected in some way of a global crisis. Imagine when sea level rise affects New York as much as it affects Dakar, and affects every place differently. And there isn't a vaccine for that. When crop failure and food shortages start becoming global, and we can't just import oranges from Spain and avocados from Peru and so on, and pay very little for them. What is happening now, the disregard for equal distribution of solutions for the COVID vaccine, for the COVID pandemic, will happen many times over in the bigger consequences of climate change. And they won't happen in one place, as we are humanitarians used to, like deploy a hospital somewhere that is affected. There isn't going to be a single place where you can deploy a hospital. So there will be bigger consequences, they'll be more generalized, and we won't necessarily be able to use the classical, whatever that is, the classical humanitarian medical model of deploying a hospital or a team from outside. So if we take this alarm, this stress test seriously, we need to think about how are we going to stay relevant in that condition.
So how, as humanitarians, having a relatively an important, but perhaps also a relatively limited responsibility, how can we address these power imbalances or power asymmetries?
Yes. Okay. And I don't think you say limited but important. Absolutely. And this is a choice. I think we still are in a situation where, as opposed to development or human rights, as was mapped many times, humanitarianism is concerned with the immediate survival of people we serve, with keeping them alive so they might actually go back on the trajectory of development or of better life. And that in itself is a worthwhile purpose, and is being done to a large extent. Now, the power asymmetries are located within and without us. The world is a place that it still carries massive divergence in power and influence. In every forum, from the Security Council to every intergovernmental agency that is concerned with humanitarianism or health, to the donors, to the political agendas that move the donors and others, to the fact that we have come, seems to me, to accept, neoliberal capitalism as the overall system that we function under. Hence, philanthropies call the shots on health and humanitarianism more than anyone else. But then we have our own, power imbalances inside the humanitarian world. We're still largely located in rich countries, functioning in poor countries. We still call everywhere else the field, but when we operate in Greece or France or so on, France and Greece are never called the field. We still find it absolutely normal to send external people to assess, other societies in a week and give a judgment that will decide who lives and who dies. But we don't accept the reciprocation of that. So accepting that the power asymmetries exist, it is time to start revisiting what mobilizes and legitimizes humanitarianism. The assumptions that people we help are absolutely helpless, unable to do anything for themselves, doesn't fly anymore. Things are different. There aren't places that are like this, at least not predominantly anymore. People have information and they have agency and they have to make their choices. So take away decolonization for a second and talk about issues of maybe we should start moving away from decisions made in the center that affect the periphery. Maybe a model of leadership. There's a book by Roberto Negri, I think, where he talks about what real leadership is. Leadership is not about the boss at the top of the hierarchy having the vision and the ability to impose the decision. Leadership is understanding the vision of people and managers acting as facilitators for the realization of that vision. Maybe this is an idea we should explore. In New Zealand, one of the reasons for the success of the New Zealand government in containing COVID was because the Maori tribes took issues into their hands and imposed their own restrictions on movement, and were able to contain the pandemic in their areas before the government was able to do that. It was published in the Guardian. So in the Guardian, and I've talked to colleagues who come from Maori backgrounds and live there, and that's not, there's nothing to say that Syrian refugees or Yemeni war displaced or Congolese people who have lived with the war for 20 years or any other group do not have it in them to organize, to actually tell us what the problem is rather than us sending someone to assess it, and to give the solutions whereby we serve the vision of that. We provide the missing information, whether that is technical, medical, or logistical, and let people go on. Some are calling this indigenizing humanitarianism rather than decolonizing humanitarianism. It's giving people enough trust and agency for them to do humanitarianism while we complement what's missing. Is that going to happen by decree? Of course not. It's not, no, very rarely does power decide to deprive itself from its privileges. But is it impossible? I don't think so. The humanitarian world has changed slowly, but it has changed, and in many cases to the better. The thing is, we don't have to wait until we change in reaction to demands of donors or to outrage of our staff or to looming irrelevance for us to think about it. We can do that preemptively.
Thank you so much, Tammam, for sharing this. We're going to continue this conversation on Wednesday, the 17th of March at 10:30 in the morning. We'll definitely continue then very much the conversation with you, Tammam, and with the audience at that stage. I'd like to thank you so much for now. Thank you.
Thank you for having me, Ed.